if you have been here for a bit, you know I'm a huge fan of red light therapy. It is a modality I use almost daily for skin rejuvenation, hair growth, or more specifically in my case, to stop excessive hair shedding, and also occasionally for injury recovery or pain management. I actually have quite a few videos on red light therapy, which I will all link down below. But just in a nutshell, red light therapy, also known as photobiomodulation, uses low-level wavelength red or near-infrared light, Beanie wants to say hi, to stimulate adenosine triphosphate, ATP, or cellular energy, within the mitochondria, the powerhouse of the cell. Now, when it comes to skin health, this boost in ATP can help with the collagen and elastin production, leading to a reduction in fine lines and wrinkles, acne scars, sun damage, and it can help improve conditions such as rosacea, psoriasis, and eczema. Similarly, when red light therapy is used for hair loss, the increase in ATP can lead to stimulation of dormant hair follicles, increased cellular metabolism, increased blood circulation, and decreased inflammation. When red light therapy is used for pain management or injury recovery, increased ATP production promotes tissue healing and reduces inflammation. There are thousands of peer-reviewed articles on photobiomodulation published in medical journals, with hundreds specifically documenting its impact in clinical settings for skin, pain, and healing. But aside from skin and hair rejuvenation and pain management, red light therapy is being explored for neurological conditions, including Alzheimer's and Parkinson's, wound healing, cancer supportive care, cardiovascular health, depression, and even eye health. The last one, eye health, caught my attention because over the past few years, I have definitely noticed a decline in my vision, with me having to depend more and more on the use of my glasses. And while I know that a worsening in vision, also known as age-related vision loss, is somewhat normal when we age, I don't like it. And I wanted to see if there was something I could do to not just put a hold on the progression of my age-related vision loss, but to hopefully also improve my vision. So I did a bit more research and learned that red light therapy can be quite beneficial when it comes to eye health. I came across several studies suggesting that red light therapy can be especially beneficial for retinal conditions, such as macular degeneration. In fact, red light therapy has been used as a treatment for dry age-related macular degeneration in Europe and certain countries in Latin America since 2018. And just last year, in 2025, the FDA authorized red light therapy as a treatment for dry age-related macular degeneration. But aside from treating macular degeneration, I also came across some research suggesting that red light therapy can help improve visual acuity, or help improve or even restore vision. As I mentioned earlier, red light therapy helps to improve the production of adenosine triphosphate in the cells. Unfortunately, as we age, every cell in our body, including our eye cells, particularly our retinal cells, produce less ATP. So evidence suggests that red light therapy can help improve declining eyesight, particularly in older adults or individuals over 40, by boosting ATP production in retinal cells. Now, this research got me excited. However, while I own my share of red light therapy devices, I didn't just want to, for example, sit in front of one of my panels with my eyes open in the hopes to improve my vision, because most of the red light therapy devices I own actually come with a warning suggesting to either wear protective goggles or to keep eyes shut. So I went on a hunt for a red light therapy device specifically designed to improve vision. And I came across some flimsy looking red light therapy glasses on the internet, but I also came across a company called Kyper Spectral Science. And when I checked out their website, I was quite impressed, because on their website they actually share a quite extensive research library, which to my knowledge includes every study done up to this point on photobiomodulation and eye health. So since I liked what I saw on their website, I actually emailed the company. They were fantastic. They wrote me right back. I asked them 1,000 questions and they answered every single one of them. And first of all, what I learned is that the company's advisory board consists of 3 ophthalmologists, which made me feel at ease. So these people know what they're talking about when it comes to eye health. Also, when I first started researching red light therapy to improve vision, I came across the same study over and over again. This particular study suggests that 3-minute exposure to deep red light, or a wavelength of 670 nanometers, at an irradiance of 8 milliwatts per square centimeter, can improve vision. Now, while this study did specify wavelength and irradiance, it does not specify the dosage of light being delivered, which is also important, and we'll talk about that in a second. But this seems to be the study some of the more flimsy-looking red light therapy glasses I talked about earlier are focusing on to sell their glasses, solely focusing on wavelength and time window. Some of them do focus on irradiance as well, but again, dosage of light being delivered is also quite important, not just for efficacy, but also for safety. And this particular study solely talks about red light therapy to improve vision. Kyper looked at every single study done to this point on photobiomodulation and eye health, and then designed a device which doesn't just have the right wavelength, but also the right irradiance and delivers the right dose of light. Again, all 3 are important when it comes to an effective and safe at-home device, which cannot just be used to help improve vision, but also to help address other eye conditions. So I'll show you the device real fast. This is the Kyper WaveFront. Looks a bit like ski goggles. And as you can see, it has a good amount of LEDs. And as far as specs, the WaveFront delivers 670 as well as 810 nanometers of light at an irradiance of 5 milliwatts per square centimeter for a total energy density or dosage of 4.8 joules per square centimeter. Now, I know these specs are boring and don't mean much to most of us, myself included, but I'm mentioning them because, again, I don't think it is the smartest idea to just sit in front of a red light therapy device we already have with our eyes open, not knowing if said device actually has these specs. Because again, Kyper looked at every single study existing so far on photobiomodulation and eye health, and then designed this device with these specs to not just be effective, but also to be safe. I'm sure pretty soon we will see more and more of these devices popping up. But right now, this device is the only one I feel safe using to improve my eyesight. Now, I did get this device sent by Kyper after I asked them if they would send me one to try. And their suggestion is to use this device 3 days a week or every other day for 16 minutes, which is a bit cumbersome, to be honest, because while I'm wearing these goggles for 16 minutes, there's not much else I can do. I can listen to a podcast, but that's about it. I can't take a nap because my eyes are supposed to be open. However, I am committed to improving my eyesight. So I will use these every other day for 16 minutes. In fact, when I first received these, I was really good about doing so. But then I had some out-of-town travel and my schedule got interrupted. But I will get back on track, use these every other day for 16 minutes and keep you posted. My hope is, with continued use, I can rely less and less on the use of my glasses. But like I said, I will keep you posted. I hope this video was helpful. I would love to know, do you use red light therapy? And if so, what do you use it for? Skin rejuvenation, hair growth, pain management, eye health? Let us know down below. Any questions or comments, of course, please leave them down below. Always love to hear from you. Thank you so much for being here. Like I said, I will keep you posted. Fingers crossed. I will need to use these less and less. And thank you so much for being here. Until next time, bye.